Let's begin with how to use the inhaler. First, shake the inhaler up and down for 5 seconds. It helps to count 1001, 1002, up to 1005. Next, remove the cap off the bottom of the inhaler. Then put the inhaler into the end of the spacer. Using a spacer helps to slow down the medicine, reduce the size of the medicine particles, increase the amount of medicine that reaches the lungs, and decrease the amount of medicine left in the mouth. Next, breathe in and then all the way out. Note, some children may not be able to do this. If the child cannot do this, tell them to just breathe in and out normally, or you can skip this step. Place the face mask over the mouth and nose. The top of the face mask should be at the top or bridge of the nose and the bottom on the chin. Make sure the mask is gently pressed against the face so the medicine does not leak out or get into the eyes. A variety of positions, sitting and kneeling, can be used as the face mask is placed over the mouth and nose. Next, spray 1 puff of medicine through the spacer and into the face mask. Finally, take 6 to 8 slow, deep breaths in and out. Some children may not be able to do this. If they cannot, tell them to breathe in and out slowly for 1 minute. If you need to use more than 1 puff of medicine, wait 30 to 60 seconds and then repeat all steps. Now let's cover a few helpful tips to maximize success. It is important to prime the inhaler when using it for the first time, or if the inhaler has not been used for 2 weeks or more. To prime the inhaler, hold it upright with the mouthpiece facing away from you. Shake the inhaler gently, then press the canister down firmly and quickly for a short puff. Repeat this procedure again so a total of 2 puffs are released. The inhaler will then be ready to use. If your inhaler has a counter, make sure to check to see how many doses are left. Always use the spacer. Clean the nose before using an inhaler with Spacer and Facemask. For younger children, you can use saline drops and then suction their nose. If the child is taking an inhaled corticosteroid, make sure to rinse the mouth after using the inhaler. Younger children can simply brush their teeth. Note, the inhaler can be used before eating or before brushing teeth. And lastly, make sure the child is not crying when taking the medicine. If this happens, you may be able to give them the medicine while they are asleep. Now let's finish up by looking at how to clean the spacer and inhaler. Cleaning the spacer once a week will help make sure it performs properly with the inhaler. First, take the spacer apart and then soak it in a bowl of water with a small dime-sized drop of dish soap for 15 minutes. Rinse the pieces in warm running water and let them air dry on a clean towel or dish rack overnight. It is also important to clean the inhaler once a week. First, wash your hands thoroughly. Remove the metal canister from the plastic inhaler container. Do not clean or get the metal canister wet. Remove the cap from the plastic inhaler container. Next, hold one end of the inhaler container under warm running water for 30 seconds. Then, flip the container over and hold the other end under warm running water for 30 seconds. If any hardened material is stuck inside of the inhaler container, use a toothpick to remove it. Shake any excess water off the inhaler container. Then place the clean inhaler container and cap on a clean paper towel to air dry. If you should have questions, please contact your doctor or pharmacist.